This is Pet Life Radio. Let's talk pets.
The DrCourtney Show is brought to you by Novavax Vaccines, essential protection for essential bonds.
Good day from California. Welcome to the DrCourtney podcast. As you could probably guess, my name is Dr. Courtney. I'm a veterinarian, host of Pet Talk and Nat Geo Wild. I want to send a big thank you to all of you who are regular listeners and those of you who are tuning in for the very first time. Obviously, this is a podcast where we get to just laugh, love, and learn a whole lot about pets. Well, whether you want to call it breaking news or developing story, we've got a big one today. We have to dive right into the news about dog flu. Whether you're listening to this podcast as the story is developing or whether you're tuning in after you've already heard the news and been privy to the information, this is going to be an extremely important conversation we're about to have. There's a blockbuster report in some of the nation's leading newspapers and magazines reporting that Florida is experiencing another outbreak of canine influenza, otherwise known as dog flu. Now, listen, there's been outbreaks in Florida in 2004, Chicago in 2015, Wisconsin 2016, Georgia, and even Los Angeles in 2017. And that's just to name a few. Canine flu has resulted in several large outbreaks, and it's sickened dogs all across the nation. So this is why this conversation is so important. So for all those pet parents out there and pet lovers, this is happening. We have to confront it. We have to beat it. That's why I'm glad we're going to get a chance to talk about it today. We've got an exciting guest who's here to help us sort out all of the conflicting information and allay some of those concerns that pet parents have all across the nation. But before we get to our exciting guest, I want to be sure that everyone out there knows how to get in contact with me. If you have any questions, thoughts, or topic discussions, you could reach me at DrCourtney DVM on Twitter and Instagram. Questions with positivity and love will get answered with priority but not exclusivity, so we'll answer anything. So right now, let's just pause for a few brief moments for a word from a true hero on behalf of pets everywhere. And then let's reconnect on the flip side to help you dig deep into the conversation about dog flu.
Sit. Stay. We'll be right back after a short pause. Well, 4 to be exact.
Hello, I'm Amanda Ryan, the Rescue Director for Helping Paws Adoptable Animals in Indianapolis, a foster-based rescue. Each year, we rehabilitate over 150 dogs in our area that are surrendered to shelters with broken bones, heartworms, skin conditions, and more. These dogs are then cleared behaviorally and medically, as well as fully vaccinated, spay or neutered, and microchipped before going to their new homes. Like Piper, a 3-year-old American bulldog who was brought into animal care and control after being hit by a car and found on someone's porch crying in pain. Piper had a broken femur in 3 places and with emergency surgery is now on all 4 paws here in Indianapolis with her new adopter. This surgery cost us $3,500 and is a large vet bill for a small rescue like us. Please learn more about us, donate, and read our success stories at helpingpawsonline.org. Thank you.
Oh, sure. It's all fun and games until someone ends up in a cone. That's right. We're animals. Deal with it. Pet Life Radio. Let's talk pets.
And thanks for staying tuned. As we mentioned before, we have a developing story that's a real eye-opener to pet lovers everywhere. It's about dog flu. And joining us today is a vet who's literally on the forefront of pet news and pet media everywhere. She's a host for her own podcast. She speaks regularly to veterinarians, students, animal lovers. She's a prolific magazine contributor. She's the world's first fear-free certified professional. I don't know how she gets all that done in a day. I mean, there's not enough hours in the day to do all of that, but she's amazing. But more importantly, though, she practices, as I would say, in the belly of the beast, the southeastern United States, Tennessee. And as we all know, it's not quite next door neighbors to Florida, but it's definitely in the neighborhood. So I'd like to welcome Dr. Primm to the podcast today. Welcome, Dr. Primm.
Thank you. It's great to be here.
Oh, thanks for joining me. Listen, I want to dive right into the conversation because this is what's on everybody's mind right now, or at least it should be. But before we do that, everybody out there wants to know, how did you fall in love with veterinary medicine? How did you actually settle in the southeastern United States?
Well, I was raised here. My practice is just north of Chattanooga, Tennessee, which incidentally is right on the interstate on the way to Florida, which is in part why I'm here with you today. So I've always wanted to be a veterinarian, and this dog flu thing is a little bit scary for those of us in the Southeast, especially the ones along the route to Florida and so close to Georgia. It's kind of a big deal for us right now.
I'm so glad you mentioned that, because a lot of people are thinking, you know what? It's in Florida. I live in, I'll just pick a random state, Connecticut. No, it's not random. I'm actually from Connecticut. But the reason I bring that up is because I went to school in Tuskegee University in Alabama, and I would travel on holidays from Alabama all the way up to Connecticut. I would drive up there or take the bus or the train. So the notion that, hey, it's not in my neighborhood, so I don't have to worry about it, you just really highlighted the fact that everyone in the nation should be focused because we all travel, right?
Absolutely. And this is kind of a big deal. The outbreak in Chicago in 2015 was a big deal, and I'm not minimizing it in any way, but this time this is dog shows. And these are dogs that go across the country. They hit a show where they see dogs from everywhere. Then they go home to their home kennels and see all the dogs that they live with, all their housemates and all their kennel mates, and then those disperse. So it's kind of like a huge network, and this flu virus is going along with all these dogs everywhere.
I'm so glad you mentioned about dogs just networking all across the nation. And here's why, is because some people might be thinking, yeah, but my dog isn't showing any signs of the flu virus, so why should I be worried? My dog doesn't look sick.
Well, actually, canine influenza has been shown to be infectious even before a dog is showing signs. So that makes it really scary. You can't tell by looking that a dog is infectious. So here you are at a show with all of these other dogs. And I spoke with someone yesterday who happens to be a veterinarian who had a dog at the Florida show, and he came home with his dog, or I think 3 dogs that he was showing, and they didn't seem sick, so he put them in his house with his other 10 dogs. So he ended up having a huge outbreak at his house, and all the dogs that those dogs saw, it just kind of becomes an epidemic really fast.
It really does. And what the highlight to that story is not only just how essentially infectious this disease can be, or the infectivity of the particular virus is at an all-time high, but it shows that even veterinarians aren't immune to this. You can know a lot about dogs in general, all of the people in the pet industry, boarding, grooming, dog shows, veterinarians, and still this virus can affect them. A lot of people will say, well, what are the signs of dog flu? How would I know if my dog has it?
Well, here's the thing. It's kind of sneaky because it's a dog that's coughing. And we have so many other infectious issues that can just cause coughing that really don't seem like a very big deal, like kennel cough. And it can actually be flu, which will make a dog much, much sicker than kennel cough will.
Well, you mentioned the notion of a dog who essentially has the virus, is spreading it, but doesn't show any signs of sickness, which is a subclinical infection. And now another highlight that you're bringing up is something of the idea of co-infections, or having potentially 2 infections at the same time. Let's say you have a situation like kennel cough, which you so adeptly mentioned, Bordetella bronchoseptica or respiratory coronavirus, and then your dog comes down with canine influenza. Things can get out of control really quickly, right?
Yes, in fact, co-infections have been implicated as one of the issues that led to secondary pneumonias, and those were the patients that became extremely ill in the 2015 outbreak, and some of those dogs even died from secondary pneumonias, and they thought co-infection was playing a role there.
Right. So I think a lot of people are thinking, well, listen, I know the word flu. I've heard about people who've had the flu. So what? It put me down on the couch for a week. That was no big deal. I went back to work. That's not the same in pets, right? And as you were saying, it could vary the signs, either mild or, as you mentioned, even sometimes it could be fatal.
Right. Well, the same veterinarian that I spoke to about this yesterday actually had a dog who died. He had had a dog die that morning, and I had no idea. He said that the dog was, isn't it awful? And I said that he said that the dog already had epilepsy, And she had never, ever had a grand mal seizure before, but she was infected with the flu. And then yesterday morning, she died. And so he said, you know what? She's never had a seizure like this before. I can't say scientifically, but I think that influenza played a role in the loss of my dog.
Unbelievable. Obviously, he said, listen, I can't know for sure if the canine influenza contributed or exacerbated the underlying epilepsy that my dog had. But I think what could be more common, or something that is more likely, is a dog who has underlying respiratory issues. Let's say your dog has a heart condition. Let's say your dog has asthma. And, I don't know if I've ever told a lot of people this, but I was on my undergrad campus at the University of Delaware, and I thought I might have had the flu. Now, I never was officially diagnosed, but I was feeling so down and out. And I figured if something else came along right at that time, it would have put me in the hospital. So do you feel that people who have dogs that have underlying respiratory issues should be particularly focused on preventing their dogs from getting this?
I think that everybody should be particularly focused on preventing their dog from getting this. And this veterinarian that I spoke to actually said, I have the canine influenza vaccine at my hospital. And he said, but I just didn't realize how big of a deal this was. And he really wishes that he had that to do over again. And so certainly my dog is vaccinated for these infectious cough things. And I would just recommend everybody, especially if you're traveling with your dog or have a dog in an at-risk type situation, dog parks, daycare, boarding, grooming, anything like that, absolutely consider talking to your veterinarian about this vaccination.
Very well said. I couldn't agree more. I wanted to get the most important stuff, right in the beginning, but let's back up for a second. We know that there's two particular strains of canine influenza. There's the H3N8 and then the H3N2. The N8 originated from horses, and the N2 we suspect it originated from birds. But the species jumping, that's not how it's becoming infectious among our dogs and at dog shows. How is it spreading so quickly? You mentioned cough. What about if dogs share toys?
Absolutely. And actually, at dog shows, it is an even worse situation because dogs are groomed in a central location. So they're waiting there for their turn with the hair stylist, and they're communicating with other dogs. And then when they're judged, the judges open their mouths to look. And so if a judge is going down a row of dogs and opening dog mouths, that's a source of infection. So
wow, that's absolutely fascinating. I didn't even realize that. I mean, let's pause for a second, because that topic or that detail cannot be overemphasized. Here I'm thinking, okay, boom, you bring your dog to a social setting, a dog park, a boarding or kenneling facility. You have dogs who are sharing toys. And that's clearly, those are all three methods, both in the air, both casual contact, and through toys. Those are three distinct methods where canine influenza can be spread. But then you bring up one of the most important examples, which is dog handlers and dog judges literally spreading it from dog to dog unwittingly.
So if you're walking your dog in a park, maybe, and the person that bends down and says, oh, can I pet your dog? If they petted a dog that maybe not even is in the park anymore, and that dog licked their hand, and then they turn and pet your dog, that's an at-risk dog. And you might look around and not even see another dog in the park and say, oh, my dog is not at risk. I never take her places that other dogs are. But actually, you do.
That's so true. That's so true. Now, one of the aspects that we talked about was looking sick, not looking sick, but spreading it around to different dogs. One of the aspects that I think is particularly just as dangerous is the length of time that they can continue to be infectious. So you can have situations where a dog who has overcome the canine influenza virus continues to be infectious. Do you feel like that's a possibility as well?
Absolutely. In fact, in the 2018 outbreak, the people were originally advised to isolate infected dogs for 14 or 15 days following infection. But they did a study that looked at it, and actually dogs were still shedding active viral particles for 20 to 24 days post-infection. So when they changed the isolation period from 15 days to 21 days, the rates of infection went down dramatically. So a dog that doesn't seem sick could still be infectious to your dog if they haven't developed the infection yet, or if they're recovering from the infection. So it's super scary.
It is super scary, and there are people who literally want to rewind what you just said because it's so important. If my dog was diagnosed with canine influenza virus, how long should I keep him isolated from other dogs?
3 weeks.
Minimum 3 weeks, everybody out there. So that is a really important point. And, we're going to get to vaccination, but part of fighting this, part of battling this virus is having the information. And there's a lot of people out there who are well-intentioned, who go about and saying, yeah, absolutely, I'm going to get that vaccine for my dog. But if they're only isolating their dog for 14 days instead of the 21 days, then it's simply because they just didn't know. So I think for me, vaccination and being armed with the information is super important. Now, do you feel that if a dog came into your hospital and had canine influenza, you suspected canine influenza, how would you go about treating that? A lot of pet parents out there right now want to know, is this condition even treatable?
It actually is treatable. Symptomatic therapy to keep the dog from becoming dehydrated and to try to address secondary infections to prevent pneumonia from happening. Any coughing dog that comes into my animal hospital right now gets kind of a red flag because I know that this is going on.
Okay. And when you get that red flag, some of the pet owners want to know, all right, well, how is this going to be diagnosed? How would I know for sure that my dog has canine influenza?
There are diagnostic tests that can actually isolate the virus and the strain. And the doctor that I talked with yesterday said that in his dog show circuits, they had over 300 dogs that had been infected. And according to the actual
300 dogs.
300, that's amazing and insane and horrible. The actual official reports are much lower. And he says that's falsely low because someone that has, he has 10 dogs. So he only virus isolated and strain typed one of them because he said it's fairly expensive to do that on all 10 of my dogs. And
Correct.
He said, and I knew they had the same thing because they were all together and they were all sick. So yeah, a falsely low number of the strain and the ID of the influenza virus, but we know that it's out there.
Yeah, we certainly do know that it's out there. And I think that, particularly for even if you have one dog, it's so important. If you have social dogs, it's very important. But particularly those who are in the pet industry, boarding, kenneling facilities, and ourselves who are both veterinarians. This is super important because we need to keep the rest of the population healthy. So what would you say to a pet parent who says, you know what, I don't feel like protecting my particular dog? It's not just about their dog, correct?
Right. And I don't think people realize we sort of maybe minimize the flu. Oh, it's just the flu. But even for human beings, the flu actually has numbers of people that die every year from the flu. And these dogs are really, really sick dogs. This is not just, he had a little cough and he was fine. These are dogs that are really sick. They have fever. They won't eat anything. They are coughing, even spitting up, coughing until they vomit. These are sick dogs.
Right. And particularly, it's not only just about the dogs themselves are sick, and that's horrible, but getting a whole bunch of other dogs sick is doubling how horrible that is. Or even worse. And the outbreak in Minnesota, there were reports that cats were becoming also infected with H3N2. So it's the kind of thing where all animals need to be protected against this virus. One thing what's interesting about the flu in itself is that it's adaptable. It can change. It's malleable. As we just talked about earlier, the species jumping, we haven't obviously seen that happen with humans with this particular virus, but the flu is incredibly adaptable and it could constantly shift and change, and that's why we need to stay ahead of it. When you're talking about vaccination for canine influenza, there's a couple of things that are really important that come to mind, particularly the fact that they're two different strains. What do you tell pet parents when it comes to canine influenza vaccination?
Well, actually, I require the canine influenza vaccine before any pet boards in my facility or spends an extended time because it's just not worth it. If I get it in my facility, it makes my patients sick, and that's my responsibility. So I do require that for my boarding. And then, of course, I recommend it for anyone that calls and says, I need Fluffy's vaccine records faxed over to XYZ grooming facility or boarding facility. I just always have my staff mention, hey, she hasn't had this and we're seeing this outbreak. So, yeah, I recommend it and require it.
That's really important. The notion that you take responsibility for all the other pets that are coming into your facility is kind of the hallmark of preventing infectious disease. We heard about a couple of situations in Pennsylvania where a boarding facility had to shut down or shut its doors to decontaminate from a canine influenza virus outbreak 3 times in 3 months. Now, for a lot of businesses, if you shut down 3 times in 3 months for weeks at a time, you might come back and you don't have a business. So I think taking responsibility for all the pets that come in by what you're doing, which is a requirement, is excellent. It's really, really awesome. And when it comes to vaccinating, people might ask, well, I see that there's a vaccination for H3N8. Doesn't that protect me against H3N2? And what would be your answer to those pet parents?
No, in fact, people know or should know just from the human strains that you can get a vaccine from the strain that the CDC has predicted will be the one floating around
right, so there's always on the news, right? It's the new strain,
You can get sick anyway. So I always recommend the canine influenza vaccination that has as many strains as available, and that is currently the 2 strains that you mentioned.
Absolutely. Bivalent vaccines, folks. It's really important that both of them are in the vaccine as you're giving it to your pet. So in a situation where your local primary veterinarian doesn't have both strains of canine influenza, your pet's going to need 2 different vaccinations for each of those strains. There is one vaccine out right now that has both strains in that vaccine. It's called a bivalent vaccine. Definitely ask your vet for that bivalent vaccine. So that's super important. And then when we go forward, we talked about vaccination. We talked about how it could be spread. You talked a little bit about isolation and prevention. What other things would you recommend for pet parents out there to make sure that their pets don't come down or they can minimize the risk of this from affecting their pet?
Well, it's just like any other infection. If you were caring for someone that was ill in your home, washing your hands is important. And washing things like the dog bowl, the dog toys, that kind of thing as your dog is recovering, because you really want to decrease contamination if at all possible.
That's great. A lot of people would discount that. They say, well, you know what? My dog's vaccinated for that. And I say, kudos to you. Perfect. But like you mentioned, diligent hand washing, diligent isolation. If there's an outbreak, secondary to the fact that we are arming ourselves with this information, that's absolutely key as well. I honestly think that this story is going to continue to develop. I think that there's going to be continued information. We're going to learn about this. And unfortunately, I have a feeling there's going to be other outbreaks in the nation. And that's not necessarily being pessimistic. It's just being realistic for people out there. Do you see that same outlook?
Oh, I definitely think that we're just on the forefront of this, and we've got to spread this word, which is why, of course, we're talking today to try to minimize and contain this. This is important.
Yeah, it is. Prompt isolation. We got to diagnose them, treatment if need be, and then widespread vaccination, in my opinion, are absolutely critical to prevent future outbreaks. Dr. Primm, I can't thank you enough today to get a chance to talk about this, shed some light on this. If we have helped one dog, I think it's a great conversation to have. But obviously our goal is to help as many dogs and pet parents as we can out there. So I just want to ask you if there's any other things you want to mention to everybody listening out there, but I definitely want to thank you for joining us.
Well, you stole my thunder when you said cats can be infected, because my show is 9 Lives with Dr. Cat, and I was going to throw in the cat thing, and you took it right out from under me. But cats can certainly...
I would never steal your thunder. I would never steal your...
Cats can certainly be infected by this strain as well. So, of course, if your dog or your cat is coughing, you should certainly reach out to your veterinarian, because this is kind of a big deal.
It's a huge deal, and you've been so great with us today. Would you mind letting everybody listening know how they can reach you or where they can find you on the web?
Well, I'm everywhere.
You really are. I don't know how you all do it all, but you're really everywhere.
On Twitter, I am Dr. Kathryn Primm. 9 Lives with Dr. Kat is, of course, on Pet Life Radio. And I am also on Facebook, Kathryn Primm, DVM. And my email address is kat@drprimm.com.
Wow, that's great. Well, listen, now your inbox is going to be filled with email. So that's great, though. The more we can help, the better, right?
Exactly.
Excellent. Thank you again for joining the Dr. Courtney podcast. I'm just so excited and energized that I got a chance to speak with you today. And let's keep focused on preventing future outbreaks of dog flu.
Thank you.
Wow. Blockbuster reports out about dog flu. I just had an eye-opening and sort of illuminating discussion with Dr. Primm just now, just in regards to everything, just how to diagnose your dog with canine influenza, why it's so scary, from everything from what we call subclinical infections, where they look healthy but are actually spreading virus, to shedding, where they're actually continuing to spread virus into the environment and they actually look fine. We talked about treatment. We talked about widespread vaccination, even hygiene. She mentioned hand washing. One of the highlights that she mentioned to me was the fact that these are happening at dog shows. So potentially we have people unwittingly handling dogs who have canine influenza and are spreading it. So listen, this virus is the kind of thing we all need to pay attention to. I want to thank everybody for joining the Dr. Courtney podcast today, and stay tuned for more breaking information and developing news. Until next time, remember, there's nothing stronger than the human-animal bond.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.